In this podcast episode, Dr. James Greenblatt, a psychiatrist with decades of experience in functional medicine, discusses the root causes of mental health issues and their impact on our lifespan. Dr. Greenblatt emphasizes the importance of understanding the connection between the brain and the body, highlighting that the current mental health crisis is actually a crisis of care. He delves into his journey into functional medicine, which began in college when he wrote a paper on vitamin B3 and brain function, leading him to the field of orthomolecular psychiatry. Dr. Greenblatt underscores the complexity of mental health issues, noting that each individual may have different underlying causes for their symptoms, making personalized treatment essential. When a patient presents with depression, he starts by conducting a comprehensive functional medicine workup. This includes looking for common nutritional deficiencies such as vitamin B12, D, magnesium, zinc, and omega-3 fats. He also examines gut dysbiosis, hormone levels, and trace minerals to understand the individual's biochemical imbalances. One common issue Dr. Greenblatt encounters, particularly in women, is low levels of amino acids due to a lack of hydrochloric acid for proper digestion and absorption. By supplementing with digestive enzymes, acid, and free-form amino acids, he has seen significant improvements in mood and overall well-being in his patients. He emphasizes the importance of addressing nutritional deficiencies and imbalances in mental health treatment, highlighting the significant impact of omega-3 fats on brain health. He mentions research supporting their role in reducing depression, anxiety, and suicide risk, although omega-3 supplementation is not yet a standard practice in traditional psychiatry. In addition to nutritional factors, Dr. Greenblatt explores the role of genetics in mental health. He mentions specific genetic variants like the MTHFR gene and the importance of considering 3 generations of family history to tailor treatment plans effectively. He also discusses the connection between mental health and gut health, pointing out the prevalence of undiagnosed celiac disease in individuals with schizophrenia. He shares stories of patients whose psychotic symptoms improved after eliminating gluten from their diets, highlighting the impact of dietary interventions on mental health. Dr. Greenblatt acknowledges the complexity of the human body and the challenges of understanding the infinite biochemical interactions that occur every second. Despite this complexity, he believes in applying principles of functional medicine to address root causes and improve patient outcomes. Dr. Greenblatt notes the importance of early detection and intervention, as well as the need for a holistic approach to mental health care. He expresses optimism about the growing recognition of functional medicine in academic settings and the potential to alleviate suffering for individuals with psychiatric illnesses. One of the key factors Dr. Greenblatt discusses is the deficiency of trace minerals like lithium. He explains that lithium is an essential mineral for human health and plays a crucial role in mental well-being. He mentions that studies have shown a correlation between the amount of lithium in drinking water and rates of suicide and mental illness. He points out that many individuals are not getting enough lithium in their diets, leading to potential deficiencies. Dr. Greenblatt introduces the concept of low-dose nutritional lithium therapy as a way to address mental health issues. He explains that while prescription lithium is used in higher doses for conditions like bipolar disorder, low-dose nutritional lithium can be beneficial for individuals with family histories of addiction, aggression, and bipolar disorder. He recommends starting with small amounts of 1 to 2 milligrams of lithium and monitoring levels through hair analysis. Dr. Greenblatt shares stories of patients who have experienced significant improvements in their mental health after incorporating nutritional lithium into their treatment. He mentions cases of individuals with aggression, irritability, and depression who saw positive changes in their behavior and mood with the supplementation of lithium. He emphasizes that low-dose lithium therapy is a cost-effective and non-invasive treatment option for mental health conditions. Furthermore, Dr. Greenblatt discusses the role of lithium in Alzheimer's prevention. He highlights studies that have shown the potential of low-dose lithium in preventing cognitive decline and reducing the risk of dementia. He explains that lithium acts as a GSK3 inhibitor, which can help prevent the buildup of toxic proteins in the brain associated with Alzheimer's disease. The podcast also touches upon the importance of incorporating functional medicine approaches in psychiatry. Dr. Greenblatt mentions the need for psychiatrists to consider specialized tests like kryptopyrrol, amino acid, fatty acid, organic acid, and hair analysis in evaluating mental health patients. He emphasizes the value of looking beyond traditional psychiatric treatments and exploring underlying nutritional and biochemical imbalances that may contribute to mental health disorders. Dr. Greenblatt shares his journey in psychiatry and how he transitioned from traditional psychiatric practices to incorporating functional medicine principles in his work. He discusses the limitations of conventional treatments and the need for a more holistic approach to mental health care. The conversation delves into the concept of precision psychiatry, where individualized treatment plans are tailored based on a person's unique biochemistry and genetic makeup. Dr. Greenblatt introduces the idea of kryptopyrrol, a compound linked to psychiatric disorders, behavior issues, and autism. He explains how testing for kryptopyrrol and addressing nutrient deficiencies like B6 and zinc can have profound implications for mental health treatment. The discussion extends to eating disorders, with Dr. Greenblatt highlighting the complex nature of conditions like anorexia and bulimia. He challenges the misconception that eating disorders are solely driven by psychological factors, emphasizing the role of malnutrition and nutrient deficiencies in these conditions. He shares insights on how addressing nutritional imbalances can lead to better outcomes for individuals with eating disorders. Dr. Greenblatt introduces the plus-minus healing plan, a framework that focuses on adding beneficial nutrients while eliminating harmful substances to support mental health. He emphasizes the simplicity of addressing basic factors like diet, lifestyle, and supplements in improving mental well-being. The conversation concludes with a discussion on the shifting landscape of mental health care and the growing acceptance of functional medicine principles within the psychiatric community. Dr. Greenblatt reflects on the importance of providing hope to individuals struggling with mental health issues and the potential for personalized, holistic treatments to transform outcomes for patients.